Hello, my name is Erin Cox, and I'm a physiotherapist. Today we're going to... Oscar, I thought I told you to stop sucking your thumb. How many times do I have to tell you? Anyway, well, today we're going to talk about the thumb. So anatomy and biomechanics of the hand. The hand, functionally, is divided into the carpometacarpal, the intermetacarpal, the metacarpal phalangeal, and interphalangeal joints. Today we're going to look at the first CMC, or the carpometacarpal joint of the thumb. So if we look at this finger, is this the palmar or dorsal surface? Palmar. How do you know? First of all, the bony shape. The palmar surface of the metacarpal has a crest. There is more articular surface on the palmar side because we need more flexion than extension to make a fist. And there is a groove for the deep flexor tendon. This is a thumb, or the first metacarpal. So this is the head of the first metacarpal, the base of the first metacarpal, and the trapezium. I know that it is a right thumb because this is the tubercle of the trapezium. And the tubercle of the trapezium is a bit more on the radial side or the lateral side. I'll show you how I know that. So is this the palmar or dorsal surface? Dorsal. And how do we know? Because the bony surface is smoother and it's more uniform. So if we look at the anatomical position, so this is the palmar surface, this is the dorsal surface. So on the palmar surface, here we have that trapezium with its tubercle, the scaphoid, the triquetrium, the trapezoid, the capitate, and the hamate. And if we return over to the trapezium, we have the first metacarpal, the middle phalange, and the distal phalange. Now, the radial side, whether I'm looking at the palmar surface or the dorsal surface, or no matter which way I change my hand, the radial side is always in line with the thumb, or it's also considered the lateral side. So now we know, is the thumb on the radial or the ulnar side? The radial side. Now, if our point of reference is from the anatomical position, no matter which way we place the hand, the thumb is always on the radial side. Therefore, it is always on the lateral side. And same thing for the thumb. We're going to make reference to the radial and ulnar sides of the thumb itself. So if I take my thumb and I look at it, well, this is going to be the dorsal surface, the side with my thumbnail. And this will be the palmar surface. So no matter which way I've got my thumb in reference to my hand, this will still always be the dorsal surface, and this will still always be the palmar surface. In which case, this side will always be the radial side of my thumb, and this side will always be the ulnar side of my thumb. So the radial side and ulnar sides of the thumb also stay the same, no matter which way I place it. But keep in mind the functional position of the hand. So the thumb is in some abduction and a little bit of internal rotation and flexion. So if I just show you the anatomical position, in fact, you could maybe all stand up and try it. If we're in the anatomical position like this, you can see how my thumbs are oriented. Then if I let them relax, they come into some abduction, a little bit of flexion, and a little bit of internal rotation, because that's much more functional than this anatomical position. So I'd like you to keep in mind some things when you're reading articles and textbooks. First of all, just take note of the date they were written. Some of the nomenclature changed around 2013 and 2014, which can make things a bit confusing because it will seem opposite of what I'm telling you. Also keep in mind the anatomical position. The radial ulnar sides and the palmar and dorsal surfaces do not change, even if the position of the hand in space changes. Therefore, we now name the movements with reference to the anatomy and not to the direction of movement in space. And don't forget also that in physiotherapy, we talk about moving the distal bone on the proximal bone when we are looking at ways of mobilizing. But I find often when the articles that are referring to the thumb, they often talk about the articular surface of the trapezium on the first metacarpal, which is the complete opposite. Just make sure you look at that. So the planes of movement of the thumb. So if we name in the anatomical position, flexion, as we said, is toward the palmar surface of the thumb, and extension to the dorsal surface of the thumb. And the abduction is toward the radial side, abduction, and then to the ulnar side of the thumb would be adduction. Here it's talking about in reference to the sides of the hand. And as far as the ab and adduction go, you can use a nice reference point as being the nail, because in the ab and abduction, the plane of movement is as the same as the nail. And as you can see here, the surface is also convex. So we can say that the abduction and adduction of the thumb follows the plane of the nail, and then in this direction, the articular surface of the first metacarpal is convex on concave. So in general anatomy, so if we look at the concavity of the carpal bones, this is if you're looking from distal to proximal of the hand. Okay, so this is going to be the thumb here. And this is what I was saying about it being a bit abducted, a bit in flexion, a bit internal rotation. So the trapezium is oriented approximately 60 degrees from the frontal plane, but the anterior surface would be facing a little bit more toward the ulnar side of the hand, in the same orientation of the first metacarpals and phalanges. The first carpometacarpal or trapeziometacarpal is a pure sellar joint, and the base of the first metacarpal is concave in the flexion extension direction, and the base of the first metacarpal is convex in the adduction. And here's another point of view. You will see that I do repeat myself in this because not everyone gets it in the same way. And I want to try to make sure the most people understand as possible. So as we said, this is the radial side or the lateral side of the first thumb, first metacarpal of the thumb. And this would be the ulnar side. And you can see that the proximal surface is convex. So in the radial ulnar, it's convexity, so it's convex on concave. Because it's a pure sellar, the articular surfaces are perpendicular to one another, so palmar and dorsal will be concave, and the trapezium will be the opposite. The biomechanical implications. Well, if we have a pure sellar joint, and the articular surfaces are at 90 degrees to one another, this also means that the oblique axes are perpendicular to one another. So if we take our flexion and extension again, so this being the dorsal of my thumb and this being the palmar, then if I want to do flexion extension, then my axis has to be perpendicular to that line of movement. Same goes for ab and adduction. So if I'm going to be doing abduction or adduction, now my axis also has to go through at a perpendicular to the position that I'm trying to accomplish. So ab and adduction, which I'm not doing very well here. Abduction, adduction. So just a little bit in the nomenclature. So if we look at the osteokinematics and arthrokinematics. So in osteokinematics, the movement in space, if we're doing flexion or in the palmar direction, We have in arthrokinematics, because it's concave on convex, the glide will also be a palmar glide. In extension, if it's going more toward the dorsal, then the glide will also be a dorsal glide, which is the opposite for ab and abduction. If in abduction, the whole thumb is going in the radial direction, we're going to want to do a ulnar glide at the carpal metacarpal, so the base of the first metacarpal on the trapezium. And then if we're going to do adduction, which will be in the ulnar direction, then we're going to do a radial glide at the base of the metacarpal on the trapezium. Merci. Thank you.